Hi everyone, I'm Kaylee and today I'll be talking about the Common Ailments Service and Pharmacy Independent Prescribing Service, both delivered through community pharmacies across Wales. I'll cover the types of conditions pharmacists can treat, how the services work in practice, and how GP practices and other healthcare professionals can support them through appropriate patient referral. The Common Ailments Service, or CAS, is a free NHS service allowing patients to access a consultation with a pharmacist. Virtually all Welsh pharmacies are signed up to deliver the service, and CAS forms a major element of the community pharmacy contract. Patients can access at any community pharmacy they choose across the country and can either self-refer or be referred into the service from elsewhere, including opticians, GP surgeries, NHS 111 and pharmacies themselves. It can be accessed by anyone resident in or registered with a GP in Wales, as well as by temporary residents entitled to NHS treatment, so holiday makers, for example, who are in Wales for more than 24 hours. The Common Ailments Scheme is a consultation-driven service. Consultations may be face-to-face or remote, but are always with a pharmacist. The service is not always instant access, although there may be capacity to see people on a walk-in basis at times. Some pharmacies offer an appointment system or request patients ring ahead, but the service specification mandates that patients wishing to access the service must be seen or referred to another provider within 48 hours. CAS is intended to allow patients access to NHS treatment for a range of minor illnesses without having to see their GP or access out-of-hours services. It provides access to expert advice from a healthcare professional who will advise appropriate self-care and supply from an evidence-based formulary if required. The formulary includes a limited range of GSL, PMED and POM products as determined by AWMSG in line with NICE guidance. The Common Ailments Service is not to be viewed as a supply of medication service or to convert appropriate purchases for medication into an NHS service. There are 27 conditions currently covered by the Common Ailments Service and are conditions which pharmacists have been managing over the counter for many years. Patients will have a consultation with their pharmacist who will decide on the most appropriate course of action for their condition. The intervention is recorded on the Choose Pharmacy system. Some conditions, namely colic, cold sores, ingrown toenails and diarrhoea, are advice only, where a pharmacist will offer appropriate self-care and/or referral but will not supply medication, as there is no evidence-based interventions for these conditions. This slide shows the number of consultations pharmacies carry out each month, which has grown steadily year on year since the service began. The service was introduced in 2013 and since then more than 1.85 million consultations have been completed. Pharmacies across Wales now regularly see around 40 to 50,000 patients each month for ailments covered under CAS. Each condition has its own exclusion criteria for management through CAS, and it can sometimes be tricky for care navigators in GP surgeries to spot these. To help with this, a range of resources have been developed to guide decisions on whether a patient is suitable for the service. If there's any uncertainty, care navigators can still refer the patient to a pharmacy, ideally asking them to call ahead so the pharmacy team can triage first. There are also limits on how many treatment episodes can be provided each year. This is to ensure that the service is used for acute short-term issues and is not used as a means of managing more chronic conditions or conditions which may be indicative of other underlying pathology. Chronic conditions or conditions not listed under CAS cannot be referred under the service. However, patients can still access advice and may be able to purchase medication from local pharmacies. The continuing training of IP pharmacists and the rollout of the Community Pharmacy Independent Prescribing Service means that some of these patients may be able to access treatment for some conditions from pharmacies offering the IP service. However, availability of this varies depending on location. If a pharmacist feels they cannot adequately manage a condition, they will make an appropriate referral to another healthcare professional. Two recent conditions added to CAS are management of sore throat and management of urinary tract infections, which both became conditions treated under the service from all pharmacies during 2025. CAS management of sore throat allows for symptomatic treatment, pain relief, and additional provision of antibiotic treatment via PGD where clinically appropriate for those aged 5 years and over. The service utilises rapid antigen detection tests for group A strep and fever pain or CENTOR scoring as decision aids. Following presentation and history taken, patients are assessed using either CENTOR or fever pain criteria. Those with fever pain above 2 or CENTOR above 3 are offered a point of care test for group A strep, whereas others are offered symptomatic treatment. Where a point of care test is carried out, the results are used to advise and discuss next steps. A negative result for group A strep provides opportunity for self-care advice and symptomatic treatment if needed. A positive point of care test gives the pharmacist the option of providing antibiotic treatment in line with NICE guidelines, following discussion with the patient about the implications of likely time until symptoms improve, side effects, and antimicrobial resistance. For all consultations, appropriate safety netting and follow-up advice is provided. The rapid antigen detection tests used give results within 5 minutes. They're not used for all consultations, and a positive result doesn't immediately result in an antibiotic. It's merely a decision aid that has been deemed cost-effective for use in this service. Use of point-of-care testing has been shown in community pharmacy settings to reduce antibiotic usage. Data from Welsh community pharmacies suggests that the rate of antibiotic supply more than doubled during the peak of the COVID-19 pandemic, when remote consultations were more widely used and routine point-of-care testing was not carried out. All CAS formulary items reflect NICE guidance, so no Difflam, for example, as it is not approved for symptomatic relief, although patients could still purchase off formulary GSL PMED items if they wish. Antibiotics only supplied if required, following a discussion with patients around risk-benefit of treatment, and 10 days is indicated with a positive point-of-care test. The second of the more recent conditions added to CAS is the management of UTI, and it's aimed at those assigned female sex at birth aged 16 to 64, with symptoms suggestive of uncomplicated urinary tract infection. The service cannot treat females outside of this range, males, or anyone else whose circumstances put them at increased risk of complicated UTI, although some of these patients may be within scope of some community pharmacy independent prescribers. The service will offer clinical assessment of symptoms following NICE guidance on uncomplicated UTI. They may be offered urinalysis if indicated, and they'll be provided with appropriate advice on self-care and, if indicated, treatment or onward referral. So possible outcomes include onward referral to a suitable prescriber, self-care advice and possible treatment if indicated. The PGDs cover the supply of 3 days courses of trimethoprim or nitrofurantoin as immediate or backup supply. Patients with hematuria on a urinalysis will be advised to return after 6 weeks for follow-up and referral made if blood is still present. As for all CAS consultations, pharmacists will provide the GP practice with an electronic summary of the consultation, and this will include urinalysis results or point-of-care test result, and any follow-up advice provided to the patient. If patient requires an urgent referral within 48 hours, they'll be given a printed referral letter to take with them, and this will also be summarised on the GP electronic consultation summary. Patients who are referred to the pharmacy service but aren't eligible to access it will be referred back to the GP practice. So next we'll discuss the Community Pharmacy Independent Prescribing Service. The service allows community pharmacists with IP qualifications to manage patients presenting with the following acute conditions listed on the slide. The Community Pharmacy Prescribing Service was first piloted in 2016 but expanded to 34 pilot sites in 2019 and 2020. It was extended to a national service from April 2022. It allows for consultations under a wide range of acute minor conditions and oral contraception. As of January 2026, almost 300 community pharmacies are commissioned to provide the PIP service. We have a national IP training programme, and all pharmacists will be IPs from the point of registration from 2026. IPs are expected to carry out consultations and prescribe only for conditions within their individual scope of practice. Prescribing scope of new IPs will be narrow, and IPs will naturally look to expand scope as part of their continuing professional development. IPs are also expected to adhere to national, regional and local guidelines and formularies, and all are required to complete the HIW Antimicrobial Stewardship for Prescribers module prior to being listed to provide the service. Funding is not based on prescribing, but on remuneration for the consultation. As with other services, we've seen a fantastic uptake and demand for independent prescribing. Since the launch in June 2020, over 472,000 consultations have been recorded, with 19,864 consultations recorded during January. The IP service is vital in reducing demand on GPs for acute minor illness, with 95% of those who presented in January reporting that they would have otherwise have made an appointment with their GP. When it comes to accessing patient records and recording consultations, all community pharmacies have access to the National Choose Pharmacy digital platform, which provides access to the Welsh GP record, including most of the information needed to make an informed decision. When it comes to the prescribing module, this includes any microbiological investigations. The same platform is used for the Common Ailments service, and where appropriate, patient information is also made available from the Welsh GP record to aid decision making. When navigating to pharmacy services, there are a few considerations. Is the condition suitable for referral? Which pharmacies in the area provide the service? And is there availability today or within the next 48 hours? And what is the procedure agreed with pharmacies in the area? Are they happy to take walk-ins? Do they ask for contact ahead to book an appointment? And so on. At the moment, community pharmacies are remunerated for undertaking collaborative working visits with healthcare providers within their local areas, and we like to encourage pharmacies to use these visits as an opportunity to discuss referrals and how they would like to receive referrals from other areas of primary care into these services. There are a number of resources to support communication and aid referral. The Welsh Government Digital Asset Bank has a lot of patient information leaflets and posters. Information for healthcare professionals is on the Welsh Medicines Advice Service website, and this website also has a condition reference guidance which includes more detail on the conditions covered by the service and the age ranges. And that's the end of a really quick whistle-stop tour of these two services delivered from community pharmacies across Wales. If anybody has any questions, please feel free to pop them in the chat. If you think of something after the session is over, then please feel free to jot down my email address. Happy to take any questions by email. And if you'd like a copy of the presentation, then please also reach out. Thank you.